Hello, and welcome to the Community News Network, Facebook Live, YouTube Live, wherever you're joining us. Thank you for joining the program here. My name is Michael Moot. I'm a special guest host today. Michael Miller is on assignment. I'm pleased to be joined today by our Miami-Dade County Mosquito Control Division Director, Dr. John Paul Mutebi. Hello, John Paul.
Oh, hello.
How are you doing today?
Oh, I'm doing great. How are
Great.
you doing, Michael?
No, never better, never better. It's a pleasure to be here with you once again. I want to thank community newspapers for allowing us this opportunity. And it's also extra special because it is Florida Mosquito Week. And so it's great to be here always, and especially great to be here during one of these sorts of awareness weeks. So let's get right into it, sir. How did you get into mosquito control?
You know what? I was introduced to mosquito control by when I was an intern, when I was attending college. I used to go and work at the Virus Research Institute, and I worked for Dr. Louis Mukwaya at the time. Now, we were studying the biology of mosquitoes at the time, and that was the yellow fever vectors, because that was when resistance was beginning to be a really big issue. And we are looking for alternative ways of dealing with mosquito populations rather than spraying them with insecticide. So that's how I got into mosquito control.
Yeah, I'd love to ask that because very seldom do I find anyone that really went into mosquito control on purpose. I definitely did not ever see myself working in mosquito control, but yet here we are. So
yeah, it's interesting. I was really interested in malaria because it was killing a lot of people. It still does.
Right.
But you know what? When I ended up at the Virus Research Institute, I changed focus and I started studying the interaction between mosquitoes and viruses. And that was what really drove me to explore further into the field and finding ways of killing them so that we reduce the risk of infecting people in the field.
That's great. So where did you attend college and grad school, and what did you study?
Yeah, you know, I attended college in Uganda at the university, Makerere University. It is in Kampala, which is the capital of Uganda. And I studied biology, that is zoology and botany, mathematics, and psychology. So after that, I worked for Virus Research Institute for a couple of years, and I applied to study to improve my knowledge of vector biology at the University of Notre Dame, and that's where I did my master's and PhD. And after that, after graduation from Notre Dame, I did postdoctoral studies in University of Texas Medical Branch in Galveston. That's where I did population genetics, virology, and vector biology. So after that, I became the chief medical entomologist and the director of the bovirus surveillance for the city of Chicago. Then progressed to work to become a research entomologist for the Centers for Disease Control and Prevention in Fort Collins, Colorado. I was there for almost 16 years. And now I end up in Miami-Dade County.
Well, we're very lucky to have you.
Oh, I'm really happy to be here.
Yes. So you've been with us now. You've been with Miami-Dade County for about a year and a half. Tell me, what is your day-to-day role like?
Now, those are basically 4 things that I do. One is coordinating. I tend to coordinate between the surveillance and the control efforts and activities to make sure that whatever we're doing is actually is having an impact on the mosquito populations out there. And all the timing and all this ecology, all the information that we are gathering to help us reduce the risk of transmission and nuisance and irritation to the residents here. Also, I oversee some research activities, both internally here and externally. Like, we are trying to learn as much as we can about the mosquito populations and their transmission potential as we go, because there is always something new that is happening. So we try to get as much information as we can so that we are not caught by surprise. I spend quite a bit of time evaluating the impact of the measures we are using, if they're working well, and what we can do to improve them, reviewing scientific literature, and actually I've been involved in quite a few of the publications with some of the information that is coming directly from here, so that we improve our knowledge, not just here, but as worldwide. And lastly, I'm involved in some communication both to the administrators and the scientific community.
and the community at large. Clearly,
At large, like today.
right here we are. Yeah. So, what is the favorite part of being the division chief? What is your favorite part of the job?
Interestingly, I enjoy being in the field.
Mm,
I guess because all our training is based on what happens in the field.
right.
That tends to be really what is important. That's what drives the transmission and the annoyance. So gathering as much information from the field as possible is of paramount importance.
Right.
But you know what? That is how we got into the field, doing
the work.
field. Yeah, doing
Right.
the work in the field.
Right.
So at times I feel really a little left out when all the work is being done by someone else, and
Someone else is having all the fun.
all
right?
the fun. Yes.
Yeah. Yeah.
And it is relaxing too.
Yeah.
Yes, because you really feel you get to know the mosquitoes a little bit better whenever you go out, and some of the stuff that has been written for a long period of time, at times it gets challenged by what you find in the field.
Right. The real work is done in the field. And as I mentioned before, I never planned to work in mosquito control. And I think a lot of what I've learned about the industry and about public health, I've learned in the field, definitely. So I can totally relate to that.
Oh, thank
Yeah.
you.
I love being out there.
Yeah.
Yeah. So talk to me a little bit about research projects being conducted at the moment. Is there anything, what's cooking in the lab, sir?
Excuse me. We have several projects that are ongoing. Now, two of them are with the University of Miami, and one of them is we are just estimating the dispersal of Aedes aegypti. Aedes aegypti is one of the vectors we have here. It transmits dengue, among other arboviral diseases. Yeah, but you know what? We do not have a full grasp of how far it can move within Miami-Dade County.
Right.
So that's like one of the studies that is going on. And that will give us an idea. For instance, if someone is infected somewhere, then we know what range we have to cover in order to prevent other people from getting infected. In other words, it gives us some kind of guideline to follow when we are responding to a dengue case. The other one is evaluating the areas that we affected by Zika and by dengue, to find out if they are the same. If they are not, what is so different about them?
Right.
So that is the kind of information we need, because vector-borne diseases have got a habit of going back to the same places over and over again. And since this is the same vector that is transmitting, then you'd think that it would be transmitting both viruses, Zika and dengue, in the same general areas. So we are trying, there's one project that is evaluating that. There is another one that is evaluating the effectiveness of an alternative mosquito control method that is using mosquito traps, like AGOs.
Is that the work that we're doing with my alma mater, FIU?
Yes, FIU, yes.
Yeah. Shout out to Dr. Matt De Gennaro.
Yes. So yeah, that one is one of those that is really interesting, because if we can actually, if they end up being really effective, then we can go to some of these places, not all of them, but some of these places, and station these traps that are going to collect the mosquitoes from the field. Then we don't have to use adulticides or larvicides to control them,
right?
Because that should be enough to drive them down. And it was used before. It was used in Puerto Rico, in San Juan, and actually it did really, really well, because it reduced mosquitoes to a level where they are not able to transmit Zika at
That's
the time.
excellent. Yeah.
Yes. And
very exciting.
So in addition to that, there are at least two other projects that are in the works, like projects have been written up. Actually, there are three. One of them is a question of trying to find out, it is being done by the University of Florida, trying to find out if dengue is endemic here in South Florida, because it has been it has been showing up like clockwork since 2002. Right. 2002, 2003, 2004, now 2005. So locally transmitted cases have been showing up every year. So one is beginning to wonder if it is endemic. And you know what? In the forests, it is maintained in non-human primates like monkeys. There are no indigenous populations of non-human primates here in the United States. But There have been there are some free-ranging monkeys that have been observed in some places, and one wonders if those are enough to initiate what you call endemic transmission. So there are that is one of the projects that is being discussed, and actually a project has been written. Another one is the University of Indiana that is studying the ecology of the vectors. We have 53 different mosquito species here in Miami-Dade County, and all of them have got like different ecologies, different habits, and what I'm trying to say, they are not equally distributed throughout the county. So knowing where some are abundant, others are not, and finding out if there are some disease associations with them, that gets to be really important, especially when we are planning our control approaches and methods. And then lastly, we have one with Johns Hopkins. Yeah, that one is another interesting one though, because it is focusing on malaria mosquitoes, Anopheles mosquitoes. And those mosquitoes, like, we tend to neglect them quite a bit because there's no malaria transmission here in the US, at least no endemic transmission of it. But there have been sporadic cases of malaria, and some of those are really close here to Miami-Dade County.
We had that scare in Sarasota and Manatee County just 2 years ago.
Yes.
Yeah.
So that is something that can evolve again. Usually, as I said, we don't pay attention to them.
Mm-hmm.
But then some people traveling from malarious areas can end up here, and then Anopheles mosquitoes can pick up the protozoan. It is a protozoan, the malaria parasite. So there's all kinds of possibilities. But also, in addition to that, there's a whole lot we don't know about the other pathogens, especially arboviruses that are being maintained here in Miami-Dade County. So the Johns Hopkins project is trying to focus on that and trying to find out what other endemic arboviruses are being circulated here, although not to an outbreak level, but subclinical transmission in some of them, so that we are ready just in case.
Right. That sounds like quite a lot of research that's going on. That's really, really inspiring to hear. That's so much science and so much data is being collected and gathered and analyzed. So that's a really big plus for us. So let's talk a little bit about mosquitoes. Let's get into what species you think is the biggest threat here in Miami-Dade County.
Oh, currently it is like Aedes aegypti. It is the yellow fever mosquito, as it is called. That's the common name.
Yeah, the Swiss Army knife of mosquito transmission. Right?
Yes, that mosquito is a vector of several diseases.
Yeah, the Zika, yellow fever, for which it's named, right? Chikungunya.
Mm-hmm.
There's one I know I'm missing.
Dengue.
Of course, the most important one.
And actually, it has been it has been suggested to be one of the vectors of Mayaro, and to some extent VEE, Venezuelan equine encephalitis. So it is a vector of quite a few of them.
Right.
And yes, that is the mosquito that is giving us a whole lot of trouble here, because it is the one that is transmitting the dengue locally here. It picks it up from people that have acquired the virus from traveling internationally.
Right.
They come back here, then the local populations here of yellow fever, of the yellow fever mosquito, Aedes aegypti, they pick it up. And then after an incubation period of about 14 days, they are able to transmit it to various people.
Right. Yeah, and I'm sure our friends at the Miami International Airport will tell you we are an international hub.
Yes.
We have lots of flights coming to and from all parts of the world. So that makes the work that we do, I think, puts a bigger spotlight on the importance of the work that we do here.
Oh, yes. It is, and you know what? Many of these Aedes aegypti-driven outbreaks, they have involved Miami all the time.
Right.
Miami and Brownsville, Texas. So they seem to be two hot spots for them. Now that mosquito is, it is domesticated. It is not indigenous here. It was brought here sometime in the 16th century from the records we have. Yes, and most likely from Africa. Probably that was the time of the slave trade when it was brought in. Yeah, it is really efficient as a vector. As I said, it domesticated. You're going to find it close to people, not in forests, not in plantations or no. It is going to be in areas where people are. And I guess that's how it was transported all over the world because of its association to people. And it is effective in very small numbers. And that is what is frightening, because in some of these places in Southeast Asia, it was found that you needed one mosquito every 2 households to sustain the transmission of dengue.
That's incredible.
So
That's not much.
It is a very efficient vector.
Right.
Yeah. The other mosquito I wanted to talk about is the common southern house mosquito, the Culex quinquefasciatus.
Culex quinx.
Yeah, Culex quinquefasciatus, yes. That is the vector of West Nile and St. Louis. It also transmits Western equine encephalitis. But that is, as the name suggests, it is Western, so you're not going to find it here. Yeah, that one tends to show up in abundance in some time periods of the year. And yes, it is another domesticated one. So it stays close to people, and it is a good vector too.
Yeah, the southern house mosquito. They call it that for a reason.
The reason, yeah.
Yeah, I understand that they thrive in different periods of the year. Is that correct?
Yes. This one tends to thrive in the drier period of the year because they love that high organic content water.
Right.
So when it rains and dilutes it out, then they are not all that abundant.
Right.
And when it is raining, it is Aedes aegypti because it prefers clean water. So there's a direct contrast. And Miami-Dade County tends to be interesting in that you've got mosquitoes all the time.
Pretty much.
Different types every time.
Yeah. So
and the third one I'll talk about is the black salt marsh mosquito, Aedes tenurensis.
Those are the ones that are native to here.
Yeah, those are natives here. And it is not an imported vector. It has been associated with some disease because it was found infected with some of the viruses. But actually, it is not really good at transmitting them.
Right.
The trouble with it is that it shows up in such high numbers.
Right, the mass emergence.
Yes, and it irritates everybody.
Yeah.
So that is the nuisance effect. And they can fly long distances.
Yes.
Some of them have been known to fly 25 to 40 miles to get to a destination. So they don't need to breed here.
Right.
They can breed somewhere else. And of course, the wind might aid them to end up here.
Right. So what are some of the things that trigger these mass emergences of the black salt marsh mosquito?
Oh, yeah, that is favorable conditions.
Yeah.
Yeah, because usually when it is dry, they end up laying eggs in the mud. And when it rains, it floods wide areas so that they emerge in millions and millions of them.
Or isn't also when the tides come in, sometimes that triggers mass?
Yeah, that triggers that too.
Mass emergency.
Anything that can flood the areas where the eggs were laid, yes.
Yeah, and that's it gets to the point where they almost look like a cloud moving around. Yes. There's so many mosquitoes.
There are so many of them.
Yeah,
and they are very aggressive.
Right. So please, ladies and gentlemen, if you encounter a cloud of mosquitoes, please call us. Please let us know. We can help you. So speaking of this rainfall and the different mosquitoes, and now that we've established that mosquito season is year round here in Miami-Dade County, when does the peak mosquito season begin?
Yeah, as you just said, we don't have a real off-season, but we have seasons of low abundance. The actual one, the peak typical one is from May to October.
And why is that?
And I think that coincides with the rainfall, because I think that is the beginning. May is the beginning of the rain season.
Right.
And usually that floods wide areas, and that leads to a lot of mosquitoes. And most of those are going to be like Aedes tenurensis or other floodwater mosquitoes. But nonetheless, they are going to cause a lot of problems because they are going to irritate pretty much everybody. Interestingly, the number has reduced quite a bit since those good old days. If you look at history, you're going to find that there used to be a lot more than they are now. But
why is that? Why do you think? What do you think is the cause of that?
That is because of habitat
the
modification,
development,
but
the urban sprawl.
And also the understanding the biology of these mosquitoes.
Right.
Yeah, because once you deny them the opportunity of having places to lay eggs so that they are flooded from time to time,
Right.
then it gets really, really easy to reduce their numbers because they don't have the habitat. So
And
the habitat modification was the factor in
that's the big one.
reducing Aedes taeniorhynchus in particular.
Right.
And that is one of the factors that led to the making Florida really inhabitable.
Right.
Yes.
The old Mosquito County, right?
Yes.
That's incredible. For those of you who aren't familiar, there was an area of Florida that at one point was called Mosquito County. It's what's now Central Florida and the areas north of Lake Okeechobee. That's since been broken up, but yeah, they actually was called Mosquito County. Look it up. I'm not even kidding there.
No.
So let's talk about some of the changes you've implemented in your time here, Dr. Mutebi.
Yeah.
What has been the major one?
Yeah, I think the major one is focusing more on proactive ways of dealing with mosquito populations. In other words, what we are trying to do is to get to them before they are high enough, so that we are not reacting to them.
I see.
Now, for that, when it comes to disease transmission, for instance, we know the areas where the disease tends to occur, like dengue. We know where the high-risk areas are.
Because we have a historical record.
Because of the records, yes. 5 years from the 5-year record clearly shows where those high-risk areas are. So those areas, we are going to them and starting doing really active mosquito control long before the season begins. And that way, we get to the larvae. Mosquito larvae are easier to control than the adults because they are confined in small places. They are relatively immobile and they're accessible. So we tend to focus on those. And there are some methods we use, like, say, source reduction, so that you get rid of the breeding sites. And if you can't, then we do some larviciding where we are using, and we are not using chemicals really. These are bacterial spores that we put in there, and they are really toxic to the mosquitoes. They are only toxic to the lower diphtheria, so they don't affect anything else. And
so pets, humans, birds, pollinators, they're not affected?
No.
So it only kills the mosquito larvae?
The mosquito larvae.
So
they are well targeted in that, or the lower diphtheria, the nematocera as they are called. So that is one of the safest larvicide you can ever use because it is specific and it is very effective.
Right.
So that is one of the things we are doing. And also, we are doing quite a bit of source reduction, as I said. That is when you are getting rid of breeding sites. Well, a few other things that we've done, like we have discontinued this routine treatments like larviciding and adulticiding in some of the areas, that mostly those that were affected by Zika.
Right, the regular truck spray routes.
Yes, it is something we discontinued because that is how you develop resistance to the insecticides you're using. We don't have many in the toolbox, so we have to be very judicious how we use them, and also that makes them less effective over time.
So when you need them, they're effective, as opposed to just spraying willy-nilly.
Yes,
and then letting the mosquitoes develop a resistance to them. So then.
Yes, actually, what you're doing is selecting for resistance.
Okay.
Because the mosquitoes are they produce a lot of young ones. Usually, like Aedes aegypti produces about 200 eggs every 2 weeks. So when you start spraying every 2 weeks, you are going to remove those that are susceptible,
right,
and leave those that are resistant. So
those will survive, and they will get to reproduce, and then
those are resistant. On. Yes,
I see.
You end up with resistant populations all the time.
So has this had an effect on our numbers? The fact that we're not larviciding on a regular basis?
No.
What has this done to our mosquito population?
And that is something we are trying to evaluate. That is why we are working with Indiana University to try and figure out what exactly is going on. So that is something we've just started. I've only been here for what? A year and...
a year and 6 months?
3
4 months? 5 months?
5 months.
Something like that.
Yes. So we are trying to figure out what the effect is, or rather what is leading to what we are observing.
Yeah, but just to be clear, we haven't seen the mosquito populations rise, even though we're not larviciding
No.
regularly.
No, we haven't.
That's an important fact to note there. So,
And something else that we've been implementing, we ended up with an outbreak readiness plan,
mhm.
just in case there's an outbreak. And it doesn't matter of what, because from what we've seen, it can be dengue, it can be Zika, it could be chikungunya, it could be yellow fever, whatever the case. So we have come up with plans to counteract those outbreaks before they get to be too bad.
So we're ready.
We are ready.
Worst case scenario.
Just in case.
Good.
And we've also changed the adulticiding schedule. When you're using insecticides to kill adult mosquitoes, we make sure that we go at a time when they are going to be most effective. And in this case, it is either at dawn or at dusk. So it is much easier to do it at dawn because that is when the traffic is still low.
Right. We know there's plenty of traffic here in Miami.
Yes.
Right.
Yes, there are some other modifications that we've been making, so I'm not going to go through them.
I understand. But no, that's good to know.
Of time, yes.
So yeah, we're running a little short on time, so we have a couple more questions. What is your advice to residents to protect against mosquitoes?
You know what? That is collectively, one, make sure there are no mosquitoes breeding on your property, and number two, avoid contact with mosquitoes. In other words, drain and cover.
Drain and cover.
Yes, whenever you have any of those water-containing objects within your yard or what, please make sure that you either you get rid of them if they are going to be discarded, or you turn them around so that the mosquitoes don't breed in there. Aedes aegypti takes advantage of that.
Right.
And
they
it
don't
doesn't
need very
really-
much water.
No, they don't need a whole lot of it.
Just
Actually,
1
it
ounce,
could be
right?
a bottle, a
bottle
bottle
cap.
cup. Yes.
Right.
They lay eggs and they distribute those eggs in such a way that at least some of them survive.
Right.
So whenever there is anything that can hold water, please make sure you get rid of it, because you don't want to give opportunity to mosquitoes to breed in there, especially Aedes aegypti. And then the cover part of it, that is mostly like if you've got exposed skin, please use any repellent. There are quite a few of them that are on the market.
Which one works best though?
Those that contains like DEET, picaridin, IR 3535, and oil of lemon eucalyptus.
Oil of lemon eucalyptus. And that, ladies and gentlemen, if you have a sensitive skin type, or if you're into some of the more natural types of mosquito repellent, we definitely recommend the oil of lemon eucalyptus.
Yes.
Yeah.
And actually, you can put some of those on the garments as well.
Right.
Or-
Especially picaridin.
Yes.
The ones with picaridin.
Yes. That-
Right. Yeah, that's an added help. So last question, where can residents learn more about the Miami-Dade County's Mosquito Control Division?
Oh, that is miamidade.gov/mosquito.
That's
That's
fantastic.
the website.
miamidade.gov/mosquito. You can also follow us on Facebook, on Twitter, and Instagram at 305 Mosquito. So that's about all the time we have for today. On behalf of the Miami-Dade County Mosquito Control Division and Dr. John Paul Mutebi, our